Hi, my name's Ilana, and I'm a nurse practitioner student, and I'm going to be doing your head, ears, eyes, nose, and throat exam today.
Okay.
How are you doing?
I'm doing pretty well, thank you.
So you just let me know if you have any questions, and we'll get started. And you just interrupt me at any time if you need anything. Okay. So we're going to start with your head, and we're going to make sure that everything looks good. I'm going to just start with palpation and inspection is how we start each of the parts of our exam today. So it's the head, ears, eyes, nose, and throat, starting with the head. So I'm going to feel out your scalp. Make sure that your head, face, and neck all look symmetrical. The hairline all looks normal. No lesions or deformities. Looks like you're normocephalic, which means that your head shape is normal and looks great. And any irritation with any of that?
Nope, it fortunately feels great.
No deformities or trauma or anything that you've had in the past?
No.
Okay. I'm gonna have you take your glasses off. And I'm just gonna kind of feel your temporal arteries. Hair looks good, good texture. And now I'm gonna start with the eye exam. I'm going to start with the portion that we can leave your glasses off for, and then we'll do the visual acuity portion after that.
Okay.
Okay, so first we're going to look at the eyes. Make sure there's no tenderness, anything around the orbital area. Have you had any pain or weakness or anything in this area?
No, it feels just...
How are your sinuses doing?
They're fine.
Okay. So we're going to look at your eyebrows for symmetry. Everything looks symmetrical. I'm going to inspect your eyes, and I'm just going to pull down the conjunctiva and look to make sure everything looks pink and moist, as it should. And now I'm going to pull up your eyelid to look at your sclera. And, white, good sclera. Everything looks great. So, you're able to open and close them. There's no fasciculations, no tremors, no flakiness or anything. Do you have redness or swelling lately?
No, it's been fine.
Okay, great. So no discharge, foreign bodies in the conjunctiva, and the sclera look great. So we're going to move on to some of the visual tests that I'm going to use some tools for. So in terms of corneal clarity, things look symmetrical, and I'm going to use my pen light to inspect and do some reflex testing. So what we're going to do on this one is I just am checking to make sure there's a reflection of light in your pupil. So I'm just going to bring the pen light in front. Okay. Looks great. And then I'm also going to check your extraocular muscles in your eyes. So just follow my finger. Okay, great. It looks like all of your cardinal visual fields are intact. And so no nystagmus, eyes move parallel, and everything looks symmetrical. So no sensitivity or any other issues around your eyes that we need to be made aware of?
No, other than wearing dark glasses in the bright sun.
Okay. No lacrimal gland punctures or issues around there?
No.
Okay, so your response to light and accommodation is good with good papillary focus. Now we're going to move on and we're going to do an ophthalmic exam. So I'm going to take this tool and I'm going to look into your eyes. So you're going to cover your eye and I'm going to look at the other one, okay?
Is it okay if I do this
one? Yeah, that one first. Okay. I'm going to get close to you, okay?
Okay.
Okay. Lens looks clear and good red reflex seen. Looks like I can't see any retinal lesions and no pulsations, vessels present. Your optical disc is orange, so that's great. Now let's move on to the other one. Okay, great. Similar findings on that side too. So it looks like everything is intact in the way that we want to see it. No papilla edema in the macula, and good depth within the anterior chamber. In terms of, let's do your visual testing. I see you wear glasses, so we're going to do the up close and the far away test, so the Snellen and the Rosenbaum test. So let's start with the far away test. I'm going to step back 20 feet, and I'm going to ask you to read which one of these can you read the line the best.
Matter which eye I cover.
Let's start with the left.
Read from the left. Okay. So it looks like PECFD.
Okay, great. And you do the one below that?
VNFO something H.
Okay. So it looks like you have 20/40 in that eye. So let's do the other eye now.
So PECFD.
Okay, good.
And then
next one
is maybe that's MDFG NV.
Okay.
Again, I'm not as.
So it looks like it's 40/20 in that one too, so that's great. Now we're going to do the up close test. So, okay, so this one I'm going to hold up 2 feet away from you, and you tell me the first, the smallest line you can read out loud.
And do I cover or do?
Yeah, from one first left.
Okay.
So those numbers.
Yeah. 63923.
Okay, can you do the next one down?
4387 something 8.
Okay. Now let's do the other eye. So same thing. Tell me the furthest down line you think you can do.
Okay. 47936.
Okay. So it looks like it's 20/40 all around in both the up close and the far away eyes. Okay, so any questions about your eyes? Any issues that you've had lately? Any issues with any parts of your face that we should address at this point?
No, I should probably get an eye exam, just maybe to up my prescription a bit.
Okay. So it looks like the only one other thing that I wanted to do is to see if you could do the visual confrontation test. So could you cover one eye and tell me when you can see my hand?
Okay, so this is like peripheral kind of stuff.
Yeah. Okay, so I'm coming. Tell me when you see.
Now.
Okay. Now this side.
Now.
Okay. Other eye. Tell me when you see.
Now.
This side. Tell me when you see.
Now.
Okay. So it looks like everything looks great with your eyes. No unilateral constriction. The eye exam looks great. We already know you have glasses and you have pretty much what your chart said that you had with the 40/20 vision. So I think that we should move on to the next system. So do you need a sip of water or anything before we do ear, nose, and throat?
That'd be great.
Okay.
Thank you.
Yeah. Okay, so we're going to do the nose, ears, and throat at this point. So we've kind of already done head, made sure that everything looks good, no skull deformities, symmetrical. So now I'm going to start with your ears. And do you mind taking off your glasses?
No problem.
Okay. So like every exam that we start with inspection and palpation. So I'm going to look, see that your ears look symmetrical. Your auricles look intact, and there doesn't appear to be any redness or swelling. Is there any tenderness of your ears?
No, feels good.
Okay. And no drainage, trauma, any recent issues with your ears?
No.
Okay, so no tenderness. I'm gonna use my otoscope to look into your ear. So I'm gonna try to go slow so I don't do anything poking. Okay. So the tympanic membrane looks good. No redness, no discharge. You haven't had any blood or anything coming out of here recently, have you?
No, occasionally just dry skin.
Okay.
Yeah.
A lot of cerumen or earwax, as they say. Have you had a lot of it lately?
No, I honestly haven't.
Okay.
Yeah.
And so I'm gonna make sure that the other tympanic, you wanna turn this way?
Yeah.
Okay. So I'm gonna look in this one. And it looks like this one is the same, pearly gray, no air bubbles, good cone of light, and no redness or perforations, no trauma or blood lately.
Other than dry skin.
Okay.
That's a chronic problem.
So, just from talking with you, it sounds like your hearing's good. I'm going to do a couple of tests with a tuning fork just to double check everything.
Okay.
So when I tap this, you're going to tell me where you hear the noise, okay?
Where you mean from which ear?
Yeah. Yeah.
Okay. Then I'll likely hear it out of one ear, not the other. Is that?
The test is for you to say which ears you hear it out of.
Okay.
Okay, so I'm gonna go boom.
I can hear it in both.
Okay, good. And then this one, this is when we're testing air conduction versus bone conduction. So this is called the Rina test. I'm gonna put the tuning fork against your bone right here and then against your ear. So you tell me how you feel it and how you hear it, okay?
Like when I hear it and when I feel it?
Yeah.
Okay.
So just let me know. Tell me when you feel it first and then when you hear it, okay?
Oh, okay.
Okay, so.
Now.
Okay. Now let's do the other side. Okay. So I'm going to do the same thing on this side.
Now.
Okay. Okay, so that all looks great. We're going to do one more test for hearing. It's called the whisper test. And I'm just going to have you cover your ear and I'm going to say 3 letters and you tell me what they are.
Okay. I heard numbers 2, 3, 4.
Yeah.
Okay.
Oh, did I say letters?
Yeah.
I apologize. Okay, not trying to throw you off. Okay, now for this one. 3 numbers. Sorry. Okay.
6, 7, 8.
Okay, great.
Okay.
So, sounds like your hearing's good. Your ear canals and tympanic membrane look great. And now we're just going to move on to kind of going down the face. I think the ears are doing great. So I'm going to put my gloves on and we're just going to do a little bit more.
Should I leave my glasses off?
Yeah, do you need them? I'm just going to be doing the mouth and neck at this point.
That's fine.
Okay. So we're going to start with inspecting the nose. And I know I already did a little bit of the sinuses, but do you feel any tenderness, any issues with your cartilage in your nose?
No, it feels fine.
And you never had any, they've never told you have sleep apnea or deviated septum or anything like that?
Correct.
Okay. So I'm going to get a little peek up there. Just make sure that your nares look patent, which means that that's how they're supposed to be. Okay, on that side as well. Look pink, moist, the way that we want them to look. No deviated septum. So no issues of tenderness in any of these areas. No cartilage issues, no masses, no displacement as far as I can see. So moving on to kind of the frontal and the sinus areas that we already checked.
Okay.
Again, you have no major issues there, no tenderness. They feel okay?
They do. They feel fine.
Okay. So we're going to now look at your mouth and kind of how all that has been. Have you had any issues with your mouth lately?
No, I have a little dry mouth, but.
Okay. But you've never felt like you've had like blue lips or like a big chunky red tongue or anything like that?
No.
Okay. Because those could indicate, if you get blue lips, it can mean you have signs or symptoms of cyanosis, which means you're not getting enough oxygen, or the big beefy red tongue could mean a B12 deficiency or some kind of issue. So just make sure to report any of those things if you ever have any issues with it.
Okay.
So I'm looking at your mouth, and everything looks pink, moist, the way that it should. I'm gonna go in and I'm gonna look to see let's see. Looks like your uvula is present. It looks like you don't have any tonsils. You had those removed?
Mm-hmm.
Okay. So now I'm going to check the cranial 12 nerve, which is the hypoglossal nerve. So can you stick your tongue out and go up and down and left and right? Okay, great. Nerves intact. Looks good. So now I'm going to assess your gingiva, which is your gum line, and just make sure that everything's looking good there, good color, and all of that. So can you open up real wide? So it looks like maybe just a little bit of receding gingiva, but I think that's normal at this point. So no recent cavities, abscesses. Looks like you have an good present upper palate, good present lower palate. The buccal mucosa looks soft and pink and moist. And you bite down for me. Okay. So everything looks good in there. Internal and external pink, moist, symmetrical. Teeth are, look good. No detected cavities, no missing teeth. Pink and moist. Gingiva, no lesions or tenderness of any of the gum lines or anything.
No. I know sometimes the dentist has me go through this. Is it the mandibular joint? It's some kind of,
he's testing your TMJ right here.
Yeah.
Okay.
But I don't think he's ever discovered any
So
problem.
no issues.
He usually tells me my mouth is really boring.
Oh, well, that's better than it being really exciting, isn't it? Okay, so tongue looks good. We got the cranial nerve, the uvula, the palates. The tonsils are not present anymore because you had surgery at one point with a tonsillectomy. And so I now want to look at your lymph nodes in your neck. So, have you had any enlargement, tenderness that you are aware of at this point?
No.
Okay, so we're going to look through, I'm just going to feel them. So we're preauricular, which is in front of the ears. And we're going to go postauricular, which is behind the ears. Not feeling any swelling or tenderness. I'm going to go occipital, which is base of the neck. And then posterior cervical. And the area you probably have experienced the most enlargement would be the tonsillar, like the angle of your jaw. Mm-hmm. And then submandibular is the halfway between the angle of the jaw and the chin. Don't feel anything there. Submental is midline under the chin. No tenderness, no swelling you can feel. And then the cervical chain along the sternocleidomastoid. And then supraclavicular is here along the cervical area. So none of that felt weird or out of place or enlarged, tender. I didn't feel anything. If I was to find something, it would probably be a pea size something if anything was enlarged, and I didn't feel any of that. No tenderness on your part.
No tenderness.
Okay, great. So the last two things I want to do is I want to just assess that your trachea is midline. So we just make sure that it's right in the middle. If it's deviated, that can mean that there's problems, and it looks like it is midline. And then next, I'm just going to do your thyroid assessment. Do you need a glass of water before you swallow?
I do, thank you.
Okay. So I'm going to check from behind, and I'm going to have you swallow, okay? Okay, feels good. And I'm going to check from the front. Have you swallow again. Okay. And all that looks great. The last thing I'm just going to do is I'm going to listen to see if there's any bruise around your thyroid.
What is a brewery?
Okay, everything looks great. It would be like a loud swooshing noise that can mean that there's some sort of abnormality in there.
Okay.
So, how do you feel? Do you feel like you don't feel like there's any issues? Because I'm not detecting any abnormalities, no lesions. Everything looks symmetrical. You look great. I think that you're all checked out. And doing a great job at taking care of yourself.
I never knew how complicated the head up was. My gosh.
Well, if the only thing you want to do is do the follow-up with your ophthalmologist about getting your, vision checked again, make sure your prescription's all set. It sounds like that's the only concern you really have. Is there anything else that you have questions about today?
No, I think it feels really complete.
Okay.
Thank you.
Okay, great. Thanks so much.
Nice to meet you.
You too.
Have measured 20 minutes and 30 seconds if you didn't.